Have you noticed that more people around you are catching cold lately? Well, in 2025, there is a new player in town called HMPV or human metapneumovirus. The thing is that this virus has been around for over 60 years, but it is recently making headlines because of the surge in cases, especially in China. My name is Dr. Mariam. I'm also a health coach. I'm going to tell you more about the virus and the things you should pay extra attention to. In the meantime, don't forget to like and subscribe for more. So, what is it? HMP virus is a respiratory virus that mainly causes cold like symptoms. Think of runny nose, cough, fever, and sometimes wheezing. But the thing is that it is not just a common cold for people weak immune system, older generation, babies. This virus can be a little more serious than the common cold, sometimes leading to pneumonia. HMPV is actually a very common virus. Actually, in 2023, a study found that 1 in 10 children that were hospitalized with respiratory illness, they tested positive for HMPV. How do we catch it? It is a very sneaky virus. That is those invisible droplets when somebody sneezes or coughs. You can easily get it that way. Or let's say that you touch a surface where the virus was there just chilling out like doorknobs or your phone. You can catch it that way as well. Or direct contact by shaking. You might want to rethink that post sneeze handshake. In as much as I said that the symptoms are mild, cold symptoms like cough, sneezing, runny nose, there can be some complications as a result of HMPV, like bronchiolitis, lung infection, like pneumonia. Sometimes the virus can spread deeper into one's lungs and can cause pneumonia. This is a more serious complication of HMPV. If you already have asthma, HMPV can make it worse. That is, you might experience more wheezing or chest tightness. This can also cause respiratory failure. This happens in cases where people have chronic lung disease or a very weak immune system. Who needs to be extra careful? Babies under the age of 2. Their lungs and immune systems are still growing and not matured enough to fight off viruses. Older adults, whereby their immune system are a little weaker. People who have conditions like asthma, COPD, or weak immune system in general. So you can share this video with them and educate them on, what they should pay attention to as well. The good news is that HMPV feels like a bad cold and it goes away for most people, especially if you rest or you have a little self care. But if you know of somebody who is of high risk, please share this video with them, pay attention to the symptoms, and seek medical help, please. How do you protect yourself? Protecting yourself from the virus is not rocket science. Wash your hands like a pro. Cover your mouth when you're coughing and when you're sneezing. Yes, with your elbow, not with your hands. And if you're feeling sick, stay home and binge watch your favorite shows on Netflix or whatever streaming site instead of going to work or going to school and spreading the love. The germs. What about the treatment? Currently, there are no specific antiviral medications and there are no vaccines either. But for most people, it's all about managing the symptoms, staying hydrated, getting rest, boosting your immune system by taking vitamin C, exercising, keeping up with the healthy lifestyle, and maybe some over the counter medications for comfort. However, for severe cases like those in the high risk group, hospitalization might be needed or required. I know you're wondering why is everybody talking about it now? So here is the tea. While HMPV has been around, and I think the first case was discovered in 2001, it did not really get much attention until recent years. Scientists have started linking it to seasonal spikes in respiratory illnesses. Just think of flu or RSV. But now HMPV is sneaking into the mix, just keeping doctors on their toes. HMPV is that underrated virus that has been flying under the radar for years. Now that it is on the big map, we've got one more reason to take care of ourselves and boost our immune system. Please like and subscribe for more content like this.